Go.
Hey everybody, sorry about the interruption, but we're back here with Facebook Live with Florida Orthopaedic Institute. Again, I'm Kyle. I'm here with Dr. Baker, our sports medicine specialist. How you doing, Dr. Baker?
Doing well, doing well.
All right, today is all about shoulder and shoulder-related injuries. Football is a high-impact physical sport. Shoulders are one of the more susceptible areas of the body. You know, you have your linemen shooting through gaps and hitting their guys, your wide receivers with their arms extended, and like Isaiah, you have your quarterbacks who might have the most vulnerable shoulders of them all. What are the most common football-related shoulder injuries that you see on a day-to-day basis?
Well, probably the most common injury that we see on a day-to-day basis is a contusion or a strain of some sort. A kid gets tackled, lands on the ground, and had some pain. They reach out for a tackle and have a strain on the arm. So most of the time, luckily, injuries aren't too serious. When we're talking about more serious injuries, we're talking about dislocations, occasionally fractures, usually at the collarbone. And luckily, we don't see a whole lot of rotator cuff injuries in kids.
All right, awesome. What about separations? Any kind of separation injuries you're finding?
Sure. So a shoulder separation really talks about the AC joint. So if you follow your collarbone all the way to the side of the shoulder, there's a little knob there. That's the AC joint. And what happens when a kid gets tackled, that AC joint pops out and will dislocate. Luckily, again, most of those AC separations, if it's a low grade, are treated without any kind of surgery.
Okay. And, you know, worst case scenario, if one of these student athletes gets a shoulder injury on the field and they come to Florida Orthopaedic Institute, what is the process from stepping into your office, from stepping into your doctor's office to, you know, walk us through the diagnosis and through treatment?
Well, luckily, most of the time we're right here at time zero. You know, some of the times these kids will have an injury to their shoulder, and I'm physically there at the time. At that time, I can assess them, whether they need to go to the emergency department or get an x-ray. We also work closely with the school's athletic trainers who can help us kind of determine if there's an injury that needs to be worked up to my level if I'm not there. After that, they'll come to our office. We'll typically get a set of x-rays, which will kind of be the baseline of their injury management. Once we have that baseline, depending on the severity of their injury, they may just go on to physical therapy. They may be able to do some home exercises. But if they have a really serious injury like a true dislocation or a fracture, they may require x-rays, MRIs, or other types of more advanced management options.
Okay. So is there telltale signs of these kinds of injuries? Say you're not there one night and they have this excruciating shoulder pain. Is there any way that they can tell whether or not it's too serious or you know, if it's serious enough to come in and see you?
Yeah, I would say two things you can do without much understanding or knowledge of the shoulder is take off the shirt and look at both shoulders. If they don't look the same, there's a problem, come see us. Similarly, if you feel along bones and you feel and hear crunching or clicking or something like that, that's probably something that we should hear about. Similarly, if a kid can't move the shoulder fully, even with pain, if they can't move the shoulder fully or there's deformity and they can't move it, then we really need to hear about that one. Kids who have full motion of the shoulder with just pain, generally that's something fairly benign that we don't need to see emergently. But if there's deformity or crepitation or you can see differences on the other side, then that's probably something that needs to be seen sooner rather than later.
Okay, what about any preventative measures that, you know, they don't need to come see you for? Any like exercises or stretches that you'd recommend?
Yeah, if a kid has a shoulder injury but has pretty good range of motion with just isolated pain, it's typically reasonable to give them some anti-inflammatory or Tylenol based on what they're able to tolerate. Do some range of motion activities, ice it, and then after the weekend, if it's still not better, maybe get in to see either the athletic trainer or myself.
All right, awesome.
And one question we have is, what kind of injury prevention can be done to avoid having a shoulder injury?
Injury prevention is tough because in these types of sports, contact collision sports, a lot of times injury prevention is not having contact, which is almost impossible. But the best thing to do is to maintain yourself in good shape and get a good warm-up no matter what the sport is or what the activity is. In the shoulder, specifically working on the shoulder blade posture and working on rotator cuff strengthening and motion. Those are usually probably the best things that you can do to prevent an injury to the shoulder.
All right, awesome. You heard it here from Dr. Baker Live. Be sure to like our Facebook, follow us. We have a YouTube channel that we have Dr. Baker on there also. Leave us a subscription, you know, subscribe to our channel, and you know, we look forward to keeping you active. Thanks for tuning in, and we'll see you next time.